For the fact number 1, I will explain the definition of musculoskeletal and connective tissue. Musculoskeletal disorder include muscular, joint and bone disease, as well as autoimmune and non-autoimmune disorders. Musculoskeletal pain affect bones, joints, ligament, tendons or muscles. An injury such as fracture may cause sudden and severe pain. Next, connective tissue. An individual skeletal muscle may be made up of 100 or even 1,000 of muscles fiber bundled together and wrapped up in a connective tissue covering. Connective tissue is found in between other tissue everywhere in the body, including the nervous system. The fact number 2 is side and laterality. Side represent which bone, joint or muscles are involved, while laterality represent placement on the body, whether it's on the right side, left side or unspecified. However, there are certain conditions may involve more than one side, which is multiple side. So, multiple code should be assigned to different side involved.
Okay, next. For certain conditions, the bone may be affected at the upper or lower end. For example, a vascular necrosis of bone, M87, osteoporosis, M80 and M81. So, the site designation will be the bone, not the joint, even though the affected part of the bone may be at the joint. The condition for acute traumatic, current acute injury should be coded from chapter 19, while the chronic or recurrent happen not because of the acute event should be coded in this chapter.
Coding of pathologic factors. 7 character A is used for active treatment, meanwhile 7 character D is used when the patient has completed active treatment. Surgical treatment related problem for fractures repairing should be coded using appropriate complication codes. Coding for osteoporosis. Osteoporosis is a systemic condition that affects all bones in musculoskeletal system. There are 2 types of osteoporosis. M80 is osteoporosis with presence of pathological fractures, and M81 is osteoporosis without present pathological fractures.
Osteoporosis without pathological fracture. Category M81 is osteoporosis without present pathological fracture. Is for people with osteoporosis who do not currently have pathological fracture. Status code Z87.310 is for personal history of osteoporosis fracture. Should follow M81 for individual with osteoporosis fracture. Osteoporosis with current pathological fracture. Patients with current pathologic fracture are in category M80. Also code from M80, not a traumatic fracture for any osteoporosis patient who fractures even from mild fall or trauma.
As you can see from the slides, the code M35.81 is being used to code for multisystem inflammatory syndrome such in adults, children and pediatric inflammatory multisystem syndrome.
Based on the case study, the condition is diagnosed with M80.051, age-related osteoporosis with current pathological fractures, right femur.
That's all from us. Thank you.